you were so involved in the addiction treatment.
Yes.
Now they call it substance use disorder. Let me start with that.
Sure.
Instead of addiction and alcoholism, the industry's trying to change the stigma. And so they have this very long substance use disorder, or SUD.
Right.
And as professionals, that's how we diagnose.
Sure.
Okay, so what do you think about that? Because I still find it's so much easier to say addiction or alcoholism. I want your take on it.
Well, it is a disorder. I mean, there's, I don't know, they're always trying to evolve or change things to make it more appropriate for the public or make people identify with it more, like mental health issues and so on and so forth. I think it all falls under one umbrella. It certainly is addiction. No matter how you look at it, they can call it what they want, or anyone can call it what they want. But it's a disease. Is what it is.
Yes.
I mean, that's the bottom line, and one that's we haven't conquered yet. That's for sure. They're trying to evolve and come up with new medications and this and that. I think it's just making it worse, to be honest with you. Whether it's Suboxone or some of the other things they come up with, but it's not making it better. It's making it worse. So there's different ways, and that's why I give you a lot of credit and why I liked your program so much. You took a different approach. You took more of a, experiential approach, if I may say, which I loved, and I think people need to identify with that. And mine has been different than that. I did try to integrate some of the things you did with equine therapy and some things, but I'm more of a holistic kind of a person because I believe the treatment industry, and I think you'll agree, in treatment, we do one-on-one therapy, trauma therapy, all these different group therapy, so on and so forth. All we're doing is talking to the brain. No one's doing anything to treat the brain. And unless you treat it, people are still, and if you continue talking to it, let's face it, if someone is using for a year, 5 years, 10 years or more, there's no way you're going to detox them in 5 to 7 days like a lot of detoxes or programs have. So when they're actually getting the treatment, they're not cognizant enough to really understand what they're going through. They need some modalities that are going to help them detox faster, like, holistic programs, but or a longer program in itself. And that's why some faith-based programs like Teen Challenge, which I worked for 2 years, they have such a great success rate because it's a 1-year program. And you're actually healing over that time, and you can become and I think that the whole element of God in your life is huge. And you're a Christian,
yes.
and you and your family are amazing people. I think that's another important element of recovery, identifying with, they want to call it a higher power, I'd call it God.